I'm going to focus on maternal mental health with my questions. Adverse childhood experiences are linked to a number of poor outcomes later in life, including mental health problems, heart disease and stroke. One such experience is some form of parental mental health breakdown, and we're currently seeing record high demand for perinatal mental health services. 1 in 5 mothers experience perinatal mental health issues, and it's the biggest killer of parents between 6 weeks and a year of their child's lives. Currently, 68,000 women are accessing perinatal mental health services, which is about 1 in 10 mothers, so about half of the 1 in 5 who are suffering. Last time this committee looked into this question, they said that there was a postcode lottery of provision of mental health services. However, the Royal College of Psychiatrists now tell us that almost 2/3 of ICBs are making real terms cuts to their mental health services. Does that concern you?
Well, I mean, we are aware of some sort of systemic issues with maternity and neonatal care, and we want to making sure that we're providing high quality and safe care, and that all women and families are listened to, and that includes postnatal care, including support for mental health. We know that, many women and babies do receive excellent care, but it is unacceptable that that's not the case for everybody. And you will know that the Secretary of State has worked really closely with the families of people that have experienced less than adequate maternal care, whether that's, two
things here. One is dealing with the individual cases and understanding what's gone wrong there.
Yeah.
And one is having the structural ability to take up an increase in demand. And if we're cutting services, mental health services, which we're told that 2/3 of ICBs are, how are we going to keep up with that demand?
Well, in terms of maternal support, we've launched the independent national investigation into NHS maternity and neonatal services. The investigation is going to make clear sets of national recommendations by December this year to achieve some high quality safe care right across maternity and neonatal services, and making sure that women and their families are listened to. So in terms of the wider support, it is that ICBs need to make those decisions about how they roll out their services, and we are supporting ICBs to do that, and we've also seen, we have had increases in the public health grant to be able to support people to do that. Specifically around 1001 days and maternal health, that will be wrapped up in terms of the maternity review and how that needs to dovetail with existing services.
Specifically on the mental health services, you say you're supporting ICBs. How are you supporting them to put more funding and more support into mental health services that they're currently cutting?
Right. Well, I mean, it is down to ICBs to decide how they allocate the funding that is provided to them and what is appropriate for their local communities. And I think it's really important that we, as we delegate that decision-making to local areas, whether that's ICBs or local authorities through the public health grant, that they do that. And I'm more than happy to come back to the committee with some specifics on mental health. It's not something that's in my my portfolio specifically, but I'm more than happy to have a look at that and come back to you. I don't know whether, Liz, whether you've got any more specific information on that.
So one of the areas we can perhaps include when you come back to the committee is there is one of the service strands that we fund in the Family Hubs and Start for Life programme is support for mild to moderate perinatal mental health difficulties, recognising that period is really, really critical, and that's really important both for the mother's health, the parent's health, but also for the forming of the bond with their child and the child's long-term health and well-being. So it is one of the strands that we funded specifically through the programme, recognising that it's an area where more support was needed, but we can perhaps wrap up more information on that in a more detailed response, if that would be helpful.
I think I
think my concern is that you're kind of talking the generalities about maternal health, but there is one specific area of maternal health where there's a crisis, and it's all very well saying it's up to ICBs, but we know that ICBs are also having cuts. So it's how are we going to make sure that those services are delivered, or we find a way to deliver those services when we've got record high demand and only about half of the women who are experiencing these problems are currently accessing the service.
Yeah, and I think what Liz has identified, is that we have put that service into the Family Hub Start for Life programme in terms of identifying that and providing that initial support through that programme. I think what we can do a little bit more work, and I'm happy to come back to the committee on, is looking at how we dovetail that with the wider mental health services. And I'm more than happy to look further at that and come back to the committee on it.
I guess that then opens up another question. You're talking about broader training of health visitors and so forth. One suggestion that's come in around perinatal mental health is training health visitors and midwives in some of the kind of mental health, identifying the problems and support. Is that something that might come up in the workforce plan?
Whether that's specific in the workforce plan, I can't tell you. As I say, it is around professional development, recruitment, retention, but in terms of being able to support those clinicians that people face on a daily, on a more regular basis, to be able to spot and signpost people for a variety of issues is certainly something that we're looking to develop as part of our hospital to community programme.
Okay, thank you.